that side of our work, and if there were things that have to end because of these circumstances, what could we replace? What activities could we do that replace that and provide new and different funded activities for our sector?
I know that one of the solutions that they're trying to do is to talk about putting films online as a way of being able to bypass the need for an audience. I mean, do you think that's a practical solution, or is that, I can't see that there's a big income coming out of that.
Look, I've seen that happen with some smaller theatre cinema chains around the world advertising that kind of thing, and I do believe that exhibition and distribution people are looking very closely at how they can address that. We know some of the big players are already placing their projects online, collapsing those windows that have been so strongly held in order that people will be accessing and paying for screen content to ensure that, that the financial models work ongoing. So, yeah, I do think there's some change might occur longer term because of this situation, and there's work doing already around that, and our departments are talking to people on that regard.
One of the things that is going to affect the New Zealand film industry, I imagine, is the International Film Festival, which is now looking, I would say, rather shaky. I mean, do we know anything about that yet, whether there's going to be an International Film Festival this year?
I do think they're a better place to comment. It is in late July, so... let's
Fingers crossed.
Our optimism hats on and wish that somehow things were in a better place by then. As you know, so many festivals have cancelled, and just recently Cannes announced that it was delaying till late June. So, that's already an indicator of their estimate of when things might be allowing a festival again. But as we know, every day things change so fast. We're looking at the global trends that are ahead of us. With the UK and USA, the shutdown of productions there is catastrophic. Hundreds of thousands of film workers out of work because of the widespread closure of production. So we are wanting to find out ways that we can potentially find new paths that aren't as destructive as that. And that's what we're talking to producers and Sparta about.
Thanks, Annabelle. And right now, the biggest problem is audiences being kept away, either by law or because of just sheer nervousness. And the big news has been the closure of so many festivals. Armageddon, Cuba Duper, Homegrown, and now, sadly, the Comedy Festival. But comedy isn't just a 2-week-a-year event. Scott Blanks from the Classic Comedy Club, welcome to the show.
Simon, how are you?
And you're still, the Classic is not closing.
It hasn't yet. No, we've followed very closely all the advice from the experts rather than the social media hysteria, and we've followed what the Ministry of Health have been saying. We've kept our operation open, but we've had to make some big changes. We introduced hyper-hygiene. There you go, there's a new phrase, hyper-hygiene, which right. We've been keeping our venue spotlessly clean and taking care of all the contact surfaces anywhere the public may be. We've also taken into account social distancing. We reduced our capacity so that the audience is spread out, which is not ideal, but the people who are coming appreciate it. So we're doing everything we can. But you mentioned the festival. Of course, the festival is a cornerstone of our industry. So we are very conscious that without a festival, that has long-term effects. You could argue that our industry banks on that festival. For instance, it's a third of my annual turnover at the Classic. I've just lost a third of my annual turnover, as has everyone in the industry, and not just the comedy industry. I'll probably, by the end of it, have lost a lot more than a third.
I know that when you opened yesterday, you were playing in front of a fairly small audience, I would imagine. But
we got 28 in last night.
Oh, that's 28 more than I was expecting, I have to say. But
everything's more than I'm expecting at the moment. But we got 28 people. They had a lovely show. The comedians shine in circumstances, as do a lot of performers. You often see these types of people are the ones first to stand up when there's a crisis, like the forest fires in Australia and other crises. You'll find that the first people to stand up are the performing artists, the comedians, the musicians, to fundraise for these types of events and disasters. Well, now they are the disaster. they're the ones who are on the receiving end, and everyone's very, very aware of that in the industry, that we've got a whole lot of vulnerable people, from the person who stands on the stage to the 10, 20, 30 people that are behind the scenes supporting that individual on stage. Every one of them is so dramatically affected by this.
I do. I admire what you're doing, though, Scott. I mean, I'm reminded of the Mermaid Theatre in wartime London. We never close, but...
Well, I saw a lovely thing about the band played on while the Titanic sunk. We are that band.
Well, I know that there was some talk about experimenting with streaming gigs.
Yes, well, this is the thing about the whole crisis. Firstly, we have to preserve our infrastructure, like the festival. We've got to make sure that everything is done, and that's where Creative New Zealand and the likes of them come in. We have to preserve all the infrastructure that's been built up over years so that we can get through the storm and out the other side. We're battening down the hatches. But at the same time, in the downtime this is going to create, we've got to look at the possibilities of making something happen. Dreaming up some outcomes, and that's where the improvisation comes in. This is where the little guy can think on their feet and improvise solutions. And one of those solutions immediately is, how can we take the talent base and get them streaming online? What can be done to make that happen? And that's the sort of work that's going on right now. And if someone's got some money for it, yeah, we're all ears.
Scott, thanks so much indeed. And Michael Moynihan, if I could just come back to you. I mean, this is a sort of a wrap-up in a sense, but I know that a number of theatres were talking about streaming at one stage, weren't they? But yeah. I wonder if that's how practical that actually is.
Well, I think it depends on where they were in the journey of that infrastructure before they started. Mm. But I think that's a very practical... Look, I think that the arts and the creative sector are in the best position to find solutions that hadn't been thought of before. And the types of brains that artists and creators have are going to go to solutions that will engage audiences. It's going to happen. What people like us, other people attached to the ecosystem need to do is to be able to enable that in the best possible way. And I absolutely agree that what we've got to be thinking of through this is what happens next. What changes? How do we ensure that in 6 or 8 months' time we are as strong as we can possibly be coming through this? And that's why we're looking at it at a kind of phase 1 or phase 2, and we're trying to think about it across the entire range of activity that happens in that creative sector. I believe too that the government will at a certain point take a coordinated view to its support for the creative sector. I'm certainly hoping that they will. It's a sector which touches such a broad range of our community.
I've had a note in here from Simon Bowden, who says there's confusion in the sector as to how the 4.5 million is new money when it appears that this is close to the amount that would have been distributed in the round that has been recently cancelled. He wondered whether... No,
it's not. It is different. It is different money altogether.
Right.
It is money that we have had in reserve, which we are using.
I'm pleased that you managed...
The money... Sorry.
No, you go.
So there is the money in the round which was being called for currently, particularly the arts grants round, which is potentially what he was talking about. And that is money that still exists, and that is going to carry on in the way that that amount of money has been ring-fenced. The money in the 4.5 is absolutely new money and hasn't been applied to a fund before.
Thank you very much indeed, everybody. I've been talking to Michael Moynihan, Chair of the Arts Council, to Film Commission CEO Annabelle Sheehan, and to Scott Blanks, who runs the Auckland Comedy Club, The Classic. And later on in the show, we're going to find out firsthand what's happening to our cinemas. Now, if you have symptoms of the coronavirus, please call the NZ COVID-19, I think it's COVID-19 Healthline on 0800 358 5453 or 0064 9 358 5453 for international SIMs. Now, if you'd like to contact us and maybe tell us your plans if any of your creative endeavours are affected by the COVID-19 situation, our email address is standingromotely@radionz.co.nz. After the news, At the Movies looks at the life after the blockbusters, and we talk to the owner of the Penthouse.
RNZ News at 1 o'clock. Good afternoon, I'm Karen McCarthy. A staff member at an Auckland residential aged care facility has tested positive for COVID-19. Heritage Life Care Group says it's working with the Auckland DHB and the Ministry of Health to identify and test any staff who were in contact with the person at the Ellerslie Garden Life Care facility. The staff member returned home from overseas travel on March the 10th and worked 2 night shifts at the home during the following weeks. They had no symptoms over that period, but after a day off, management was told the person had a headache and tests came back positive for COVID-19. All residents in the staff members' work area are now isolated, as are other staff members. GPs are planning to do most of their consultations online or over the phone from tomorrow. Many clinics have been preparing this weekend to carry out consultations remotely. Kay Albert reports.
GPs have been asked to do more of their consultations by phone, email and video in order to reduce the number of people sitting together in a waiting room. It comes as the government warns people should limit their contact with each other amid the COVID-19 outbreak. Patients requiring face-to-face appointments with their GP will still get them, but in many cases they'll have to talk with their doctor first over the phone. Although the country is still on level 2 of the COVID alert system, under level 3, primary care consultations will have to be virtual. The New Zealand Royal College of GPs says the decision hasn't been taken lightly, but they're confident it's the right action to take. Ko Kay Albert tēnei.
There will be no long goodbyes at the departure gates at Auckland Airport from today as the company tries to manage social distancing. From this morning, only travellers with valid passports are able to go into the international terminal. Public announcements will be made inside, reminding people to keep their distance from each other because of the COVID outbreak. The airport's operations manager, Anna Cassels-Brown, says passengers will still have the chance to say their farewells.
That people will be wondering if they can still come and meet and say goodbye to their loved ones and friends, and of course they can. We've made our main car park available for this, free of charge for 2 hours, but we ask that those people do not come into the terminal, only travellers who have confirmed travel enter the terminal.
Anna Cassels-Brown says there will be messages posted on the way to the airport to alert people to the measures. The Australian Prime Minister Scott Morrison is set to unveil a new economic stimulus package worth $66 billion today, including relief for retirees and a new wage or safety net for workers who lose their jobs. Not-for-profits and small businesses will receive a tax-free cash payment of up to $100,000. The Australian government has already launched a $17.6 billion economic stimulus package just over a week ago. Building product suppliers are being urged to get to grips with just how COVID-19 will disrupt their supply chains. The Building Industry Federation says some companies don't understand the extent of
the COVID-19 media update today. Today we have 14 new cases of COVID-19 confirmed by laboratory testing. The locations are Auckland, 5 cases, Northland, 1 case. Canterbury, 1 case, New Plymouth, 2, Waikato, 2, including 1 in Hamilton. We have 1 in Tauranga, 1 in the Coromandel, and 1 in Dunedin. All these cases are in self-isolation, with close contacts being identified, followed up, placed in self-isolation, and then regularly monitored. 11 of these new cases have a history of international travel. 1 is a close contact of a confirmed case, and 2 were at the World Hereford Conference in Queenstown earlier in the month, which had a range of both New Zealand and international delegates. This brings the number of confirmed COVID-19 cases in New Zealand to a total of 67. We have 4 probable cases as well. These are cases that have previously been described. However, even though we thought they were COVID-19, laboratory testing was negative, and we are treating them as probable cases. Just over 1,200 laboratory tests were carried out yesterday around the country, and that brings the total number of tests carried out to date to over 6,000. An update on community transmission. There were 2 cases announced yesterday where community transmission could not be ruled out. Our further investigations of these 2 cases have still not identified a firm link to overseas travel. Just for clarity, community transmission is when we cannot confirm exactly where the infection came from. As we investigate these cases further, including close contact tracing, this increases our understanding of what the infection pathway may have been, and we can then communicate with anyone who was a close or casual contact and ensure that appropriate action is taken. We can also then update local communities about events or situations where contact may have occurred. So in both those cases, that work is ongoing. I understand that people in the areas where those 2 cases live will be concerned about the risk of transmission. So I ask you to just, everybody in those regions, continue with good hygiene practice, physical distancing, and seek advice if you have symptoms. Details for each of the cases mentioned today and the tally of confirmed cases will be on the Ministry of Health website as soon as they are finalised and not long after this media update. An update on the 2 cruise ships, the Ruby Princess and the Celebrity Solstice, which recently visited New Zealand and both of which had confirmed cases of COVID-19 which were confirmed subsequent to their departure from New Zealand. We are asking any passengers on those 2 ships who left the ships during their stay in New Zealand to self-isolate for 14 days since they last had contact with other ships' passengers, and of course to be aware of symptoms and seek advice if they do develop symptoms. Details of the movements of both ships can be found on our website. And as mentioned yesterday, we are also in direct contact with the New Zealanders who were on board those vessels. Some are still in Australia and have yet to return to New Zealand. The customs officials have the details of those people and they will be identified at the border. They will be asked to self-isolate along with every other person entering New Zealand now and to register with Healthline. Coming back to the Hereford Cattle Conference in Queenstown, our public health team is following up delegates to that conference, which was held from the 9th to the 13th of March, and 4 attendees, including 2 New Zealanders, have tested positive for COVID-19. The other 2 are an Australian and someone from Uruguay. Close contacts of those cases are being asked to self-isolate, and other attendees at the conference are now considered as close contacts in a precautionary way, and they have also been contacted and required to self-isolate for 14 days since they were in contact with people who were at that conference. Southern District Health Board is doing the tracking and tracing work on this with support from the Ministry of Health. Just an update then on the alert level. The alert level remains at level 2. You will note from the presentation the Prime Minister made yesterday that as part of Alert Level 2, we are asking people with pre-existing conditions such as chronic respiratory disease, which might include severe asthma, bronchiectasis or COPD, chronic obstructive pulmonary disease, and people who are immunocompromised, for example, if they are having cancer treatment, to remain at home. A message to the over 70s. We know many of you are fit and healthy and living active lives, but the older we are, the less our immune system is able to fight off this virus and indeed other infections. And we have seen from overseas that older people are at more risk of serious complications. So we are strongly encouraging you, in fact urging you, to be aware of the need to stay at home and not to have contact with others. So please do heed the advice to stay at home. Ask friends and families, particularly children, not to visit. For the meantime, this may mean talking to your family on Skype or some other method. I'll finish my comments there and welcome any questions.
Can you give us an update? We've heard that there's one critical patient in hospital in ICU. Is that right? And do we have any other critical patients in hospital?
No, there are no patients from the information I have who are in ICU, and in fact, I don't think there are any of the new patients who are even in hospital at this point.
And then what about the recovered cases? How many of the cases?
Yes, we're still working on that. That requires us to go back and check with each clinician what the status of those patients are. So we are working on that, and we hope to have that information in the next day or two.
What do you say to people who are having trouble getting through to the Healthline? They're saying they're being disconnected after waiting for hours on the phone.
So, yes, the Healthline is overloaded. By the way, it's not the only government line that is overloaded. What I would say is to everybody, remember that Healthline is there to give health advice. It is not there to give general advice about COVID-19. It is not there to give information about self-isolation. That is freely available on the COVID-19 website and the Ministry of Health's website. It is not there to just make general inquiries about COVID-19. If people use Healthline as it's intended, which is to ask about symptoms and seek health advice, then we have a sufficient capacity to deal with the load. So just a plea really to everybody to use it for what it's there for. Anyone who needs to self-register can do that online. They don't need to ring Healthline to do that. Please.
We have modelling from a team of university researchers that suggests an ICU capacity overload in New Zealand could mean the difference between a 1% and 2% case fatality rate. Is that what we're looking at?
Yes, well, the modelling is very helpful in that it shows us exactly what would happen if we didn't act quickly and didn't act with great certainty, and that's why we have been. And you've seen the Prime Minister yesterday talk about the alert levels. We're at alert level 2, and the reason that 3 and 4 are there is because we're signalling we may well need to move to those, and the reason we would move to those is to avoid a situation where we overloaded our healthcare system, including our ICU capacity.
We've had reports out of Hamilton that some people are still being declined tests even if they're displaying symptoms because they're being, and the explanation that's been given is that they're being told to not give tests to people unless they've been in contact with one of these cases. Is that the advice they're getting from you, or are they not applying the new standard for testing properly?
So the standard for testing is that the right people get tested. And the case definition is still clear that at the moment people should have a history of overseas travel or an obvious link to that, or a history of being a close contact of a probable or a confirmed or a suspected case, and they should have symptoms. So we shouldn't be at this point, and we can't be testing everybody who has symptoms of an upper respiratory or lower respiratory tract infection. And that is a reasonable thing to do. But as I say, over 1,200 tests yesterday, nearly 6,000 completed. It's important we test the right people, not people who are at low risk. Most of our tests are still coming back negative.
Out of the 14 cases today, you mentioned that 11 had clear links to overseas. What about the other 3?
Yes, so the other 3, 2 are, one is a contact of a confirmed case. So that person was symptomatic and therefore tested and came back positive. And the other 2 were people, New Zealanders, who attended the Hereford Cattle Conference, hadn't been overseas, but there was a meeting at which there were overseas delegates. So we would classify those as having a clear link to overseas travel rather than community transmission.
A retirement home in Auckland has confirmed they have a positive case in their village. How concerned are you about this?
If it's the case that I know about, and I think that was yesterday, and they've put out a media release, this was someone who lives alone in their own place, and so I don't have a particular concern because all the right steps were followed there. Perhaps the last question.
Sorry, lots of universities are being shut down. What's your message to parents in terms of bringing their kids home from university halls and hostels?
Well, I think it's a couple of weeks before the end of the university term anyway, and it may well be that that university students want to get home because they'll be working online anyway. So they might. That's an individual choice. Perhaps last question.
Can I just ask about the long weekend in Otago? Are you concerned about delays to testing there, or other sort of issues related to that long weekend in terms of the response down there?
2 comments. First of all, testing continues right through the weekend around the country. Secondly, our laboratory staff are not indefatigable. They need rest as well, and that's again a reason. It's not just the supplies and equipment. We need to make sure that our staff are getting sufficient rest so that they can continue to staff our laboratories, and so that's part of. I'm hoping and expecting that they will be giving staff downtime, but we're not expecting delays in testing results. Thank you very much. I do appreciate your ongoing support and interest.
Hua Jun, Commander, son of Hua Zhou.
We're going to make men out of every single one of you.
Well, the good news for fans of The Big, The Fast and The Furious is that these films have merely been postponed, not cancelled. And when the threat of the coronavirus eventually subsides, they'll all be back, possibly better than ever. They'll at least have had time to buff off any rough edges.
No matter how fast you